Hey, Maria, I appreciate you being here today. Would love to hear more about who you are and why you're seeking support.
Thanks for having me. Honestly, I'm just trying to find some clarity. It's been rough. These rituals and thoughts are kind of swallowing my life. I used to teach, but lost that job recently, and now I'm just overwhelmed. I guess I'm looking for help because I can't keep losing myself to this. I just want some peace?
Yeah, I am sorry to hear that you're experiencing so much trouble from this, and it does sound like it's very bothersome. I definitely want to look into how we can best help you, and maybe you can tell me a little bit more about the obsessions and even compulsions that you're experiencing.
Yeah, sure. It's mostly about like checking and washing. I'll spend ages making sure doors are locked or my hands are clean, and if I don't do it perfectly, I'm terrified something bad will happen to my dad. It's just this cycle of fear and guilt that won't let go, and it's exhausting.
That would be exhausting, and I'm sorry to hear that you've lost your job because of this. We need good teachers out in the world, so let's definitely kind of collaborate together to find out how to best help. Maybe if you can tell me a little bit more about some of the specific obsessions you're having. You've mentioned that you have a fear that if you don't do the compulsions, that there'll be harm to your dad. Any other obsessive thoughts or intrusive images?
Thanks, I appreciate it. Yeah, besides worrying about my dad, I get these intrusive thoughts about fires or accidents if I don't unplug everything. It's like my mind just jumps to worst case scenarios and I can't shake them. Even if I know they're not logical, the fear is just overwhelming, honestly.
Okay, and that does sound really troublesome. Again, I'm sorry you're experiencing that. However, you're not alone. OCD is very treatable, typically with a combination of therapy and sometimes medicine. Therapy is very effective for this. And I'm kind of curious as to maybe what you've tried in the past and if anything's helped at all.
Thanks for saying that. Honestly, I haven't really tried much. I was kind of avoiding it, I guess. There's this fear of admitting I need help? I've tried to distract myself or just push through on my own, but it hasn't really worked. I'm hoping therapy can be as different, though. I'm ready to try something, anything, to change this.
Well, I appreciate your courage and willing to seek help. And I do want to acknowledge that a lot of folks with OCD have experienced symptoms, the obsessive thoughts or intrusive images, for years. Sometimes, as I've heard, as much as 10 years before they ever seek help. Do you know about when this started for you?
Hmm. It feels like it's always been there, honestly. But I guess got really bad in the last few years. I remember seeing my dad do similar things when I was a kid, but we never talked about it. It's like it just crept into my life slowly until it took over.
Okay, okay. So there may be some genetic predisposition involved here as well. And so, again, you're not alone. Maybe even your father experienced this. Can you tell me a little bit about the compulsions that you do to try to ease the fear that you have from these thoughts?
Yeah, it's a lot of checking and washing. I'll lock doors repeatedly, even when I know they're secure. Unplugging appliances is another big one. I'll do it over and over. And washing my hands, it's almost ritualistic. Each compulsion feels like a must do to prevent disaster, even though I know it's irrational. It's just the only way I've found to ease that intense fear, even if it's temporary.
Okay. And again, these are, I hear how disruptive it is to your life. These are kind of common symptoms of contamination, is what we would call this. I'm kind of curious about how much time in a given day on average do you spend with the compulsions?
Oh, it's a lot. I'd say at least a couple of hours a day, especially in the evenings. Sometimes I lose track of time entirely. It's like once I start, I can't stop until it feels right, which it rarely ever does.
Yeah.
It's draining, and then I'm just stuck in that cycle, unable to do much else.
Okay. Um, and and so again, you've mentioned that you lost your job as a teacher because of this. What maybe specifically led to the job loss?
Yeah, it was kind of a mix of things. I'd get so caught up in the rituals that I'd be late or distracted, and it affected my performance. I guess my energy was just drained from all the stress, and I couldn't keep up. It was like I was there physically, but mentally I was elsewhere. Eventually, it just slipped away from me.
Yeah, that's natural. Again, it's not uncommon for people to have experienced this, and I am sorry to hear that because we do need good teachers out in the world, and I think we can make good progress. It sounds like you're pretty committed to wanting to get help, and this is something you've experienced for a while, and it sounds like you're ready.
Thanks. I really appreciate that. Yeah, I'm definitely ready to try something new.
Okay.
It's scary, but I'm tired of feeling trapped in this cycle. I want to teach again, to be present, and actually enjoy life. I'm
Yeah.
hopeful that with some support, I can start moving forward. It feels like the right time to try and reclaim my life.
Nice. And maybe what we can do is look at this as, hey, that was a chapter of your life, and what we're doing now is beginning today, starting to create chapter two, or maybe it's chapter 10, whatever, but a better life for you. So I definitely want to spend some time knowing about what your heartfelt values are, what your goals are, because I suspect you haven't been able to spend a lot of time with that in the past. But that's going to be helpful for us to move forward. Because one thing I will say is that OCD, as disruptive as it's been for you, it's still just a part of you. It's not your entirety. And I want to make sure that we can kind of make sure that we're paying attention to your entirety, the capital S self, if you will. With that said, I do like to begin with you taking a couple assessment instruments that may give us a little clearer picture of exactly what types of obsessive thoughts you have, and also how much time you spend with the compulsions. And we can do that together. Sometimes it's helpful to read those together, or you could do that on your own time before we meet next time. How does that sound?
Yeah, that sounds good. I'm definitely open to whatever helps us get a clearer picture of what's going on. Honestly, I've been so focused on just getting through each day, I haven't really thought about my values or goals in a long time. It feels kind of daunting, but also like a chance to really understand myself beyond all this. I'd like to try the assessments together if that's okay. I think it'll help me feel more supported.
Great, great. We can go through those together. And yeah, let's consider today beginning kind of chapter two, and we're gonna not only address and hopefully help reduce the symptoms of OCD, but also looking at where you want to go that would be enjoyable and give your life meaning. So we'll take a look at that. I do want to mention, Maria, as you can see, I'm an older white male raised in the South. I probably experience the world and see the world differently, and I would say that with everybody. We're all kind of unique, but I'm kind of curious about how you define yourself, and what we can do together to work best together.
Thanks for asking. I appreciate that. Honestly, I've always seen myself as a Latina woman trying to balance cultural expectations with my own needs. Family and resilience are big parts of who I am, but I've also felt pressure to be strong even when it's tough. I think being open about my struggles is a step towards being more authentic. I'd like to bring that into our work together and maybe explore how my background influences my experiences and how we can navigate that.
Thank you. Thank you for that information. And let's just consider this kind of the starting point for us making sure that we're attending to kind of our professional relationship here. So if anything I say it feels dismissive or discriminatory, please let me know. I definitely want to make sure we've got a productive working relationship. And so we can address that at any point.
Thank you. I really appreciate that openness. It's reassuring to know we can talk about these things. I want this to be a safe space where I can be honest and feel understood. I'll definitely let you know if anything feels off. It's
Th-
important to me that we're on the same page as we work through this.
yeah, likewise, likewise, and so I appreciate your cooperation, willingness to seek help, and collaboration. I'm going to go ahead and end this, and we will talk about the assessments on the next visit.